Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
Today's video will discuss 1. Meridians and collaterals are located between the skin muscles, tendons, vessels, and bones. 2. Meridians have many layers, thus different depths. Some exterior pathways can be seen or palpated easily. 3. Acupoints are located between the skin, muscles, tendons, vessels, and bones. Needling should consider the depths. Meridians and collaterals connect all body components, making the body integrated.
We know that the human body is an integrated one. The human body has many components: 5 Zang organs, 6 Fu organs, 5 constituents, 5 sense organs, and 5 vital substances. The 5 Zang organs are heart, lung, spleen, liver, and kidney. The 6 Fu organs are small intestine, large intestine, stomach, gallbladder, urinary bladder, plus triple energizer or sanjiao. The 5 constituents are skin, muscle, tendon, vessel, and bones. Those components are not isolated. They are connected by meridians and collaterals. Meridians and collaterals connects the inside with the outside, making them work together. What moves and circulates on the meridians and the channels are the 4 body substances: qi, blood, essence, and body fluid. Thus, all the Zang-Fu organs, tissues, and sense organs can be nourished by the body substances and function regularly. Meridians and collaterals are different concepts. In a simplified expression, meridians goes longitudinally from head to toe in an upward-downward fashion. The collaterals branch from the meridians and run superficially and transversely all over the body like a net.
Meridians and collaterals are the space between the skin, muscles, tendons, vessels, and bones.
Many modern researchers have been trying to find out what meridians and the collaterals look like. In a way, they discover the nerves, tendons, muscles, vessels, and the bones. Those scientists believe that meridians and collaterals are material things that human eyes can see and human hands can touch. However, those researchers made a fundamental misunderstanding of meridians and collaterals, as by traditional Chinese medicine definition, meridians and collaterals are not visible substances, but invisible spaces located between the muscles, tendons, vessels, and the bones. Modern technology like CT, X-ray can detect muscles, tendons, vessels, and the bones, but cannot detect the space in between the muscles, tendons, vessels, and the bones. Think about valleys on the earth, which is a good metaphor for meridians and collaterals. When you think about a valley, 2 sides are mountains and hills. Usually, a stream forms the base. The mountains and the streams are the material substances that you can see, but the space itself is the empty space in between. If there is no space in between the mountains, everything's packed together, you cannot call it a valley. The idea of a valley works the same for meridians and collaterals. Meridians and collaterals are located in between the muscles, tendons, vessels, and bones. This is a structure of muscle in anatomy. Each muscle is made of many smaller muscle fibers, which are wrapped by a layer of fascia. There is space in between those muscle fibers. Each smaller muscle fibers is further made of even smaller muscle fibers, again wrapped by a layer of fascia. We know that all the Zang-Fu organs and tissues has to be nourished by vital body substances, which is nourished by qi, blood, essence, and the body fluid. Those spaces between the cells and the tissues are exactly where the qi, blood, and the body fluids go through. Where the spaces, the qi, blood, and the body fluid can be transported to the cells and the tissues to nourish them. As the skin, muscles, tendons, vessels, and bones are made of cells and tissues. Depending on the structure, the spaces between them can be big or small, shallow or deep, with different moving direction. All of the spaces are the pathways for transporting the qi, blood, and the body fluid. So by definition, they are called meridians and collaterals. Once you understand that meridians and collaterals are the spaces in between the skin, muscles, tendons, vessels, and the bones, it's easy to understand that why the machine and the technology cannot detect meridians and the collaterals. However, it still exists just like many other invisible things. For example, I'm talking to you at this moment. You can see me, but you cannot see the concepts and ideas we are discussing. Meridians and collaterals have exterior and interior pathways. The exterior pathways are the lines distributed on the body surface. The interior pathways run inside and connect with the internal Zang-Fu organs.
For example, there are about 16 interior pathways connecting with the heart. Generally speaking, except the large intestine channel does not connect with the heart directly, other Zang-Fu organs all have direct connections.
Some of the exterior pathways can be seen directly, and others has to be palpated to locate. Here are the examples.
The forearm part of the pericardium channel is located between the muscles of the palmaris longus and flexor carpi radialis. When people flex the wrist, especially against resistance, the two tendons will pop out, leaving a groove in between the two muscle tendons. This part of the pericardium channel can be seen easily.
Can you please make a fist? Great. Now flex your wrist against my hand. See, there's two tendons popped out. This one is the palmaris longus. The other one, close to the radius, is the flexor carpi radius. In between the groove is the channel of pericardium.
Example 2. The governor vessel and conception vessel on the trunk part run right through the middle of the body. It would be tough to miss these two lines on bodybuilders.
The exterior pathway of the spleen channel on the abdomen part goes along the palpable depression at the lateral border of the rectus abdominis muscle.
The external pathway of the lung channel on the arm part goes along the depression between the lateral border of the biceps brachii muscle and the shaft of the humerus.
Example 3. The bladder channel on the calf area is along the depression formed below the bellies of the gastrocnemius muscle. Usually, it is not obvious to see it in a regular person, but by palpation, the groove between the bellies of the gastrocnemius muscle is distinct under the fingers.
Hi, Mary. Are the blood vessels in blood circulation in Western medicine the same as the meridians and collaterals in TCM?
The answer is both no and yes. First, the vessels are not the meridians, but the physical boundaries constituting the meridians and the collaterals. The spaces inside the vessel belong to the meridians and the collaterals. Bear in mind, qi is carried by both blood and the body fluid, and qi promotes the circulation of blood and the body fluid everywhere in the human body. Therefore, not only the blood circulation system belong to meridians and the collaterals, the spaces outside of the blood vessels, where the body fluid moves and distributes, also belong to the meridians and the collaterals. These pathways where qi and the body fluids flow are called sanjiao or triple energizer. We know muscles in the human body has different layers, superficial layer and the profound layers, which makes the meridians has different layers as well. Here is an example of the different layers of meridians at the level of Chengshan bladder 57. On the exterior surface, the acupoint of Chengshan bladder 57 is just an entrance into an interior world. Depending on the depth of needling, the needle can go through level 1, skin, level 2, gastrocnemius muscle, level 3, soleus muscle, level 4, flexor hallucis longus muscle, level 5, artery, vein, and nerve of the tibialis posterior muscle. Level 6, tibialis posterior muscle. Usually, the spaces between the muscle groups are more extensive than the spaces between the muscle fibers within a muscle. Check the cross-section of a pig leg. The muscle layers and the spaces between groups of muscles are easy to locate. Here is the illustrations of multiple layers of the meridians of our body. Relatively speaking, the skin and the muscles are in the superficial layers. Tendons, vessels, and bones are in the deeper layers.
Hi, Mary. Since meridians have different layers, which level or how deep should the needle be inserted?
Acupoints are located on the meridians. Therefore, acupoints are also located in between the muscles, tendons, vessels, and bones, and have depths. How deep the needle should be inserted depends on syndrome differentiation. Generally speaking, with an acute exterior problems and in spring and the summer, the depth of needling is relatively shallow, and with chronic and internal diseases and in fall and winter, the depth of needling should be relatively deeper. Furthermore, to treat a skin problem, the needle should be inserted shallowly. To treat muscle-related problems, the needle should be inserted in between the muscles underneath the point. To treat a tendon-related problem, the needle should be inserted close to the tendon underneath the acupoint. To treat a blood-related problems, the needle should be inserted deep until to the side of the vessels underneath the acupoint. To treat a bone-related problems, the needle should be inserted deep all the way until reaches the bone. Here is an example of needling Chengshan bladder 57. Bladder 57 is one of the Ma Dan Yang's 11 heavenly star points and is frequently used clinically. Chengshan bladder 57 is located in the depression found between the two origins of the gastrocnemius muscle bellies. This is one of the biggest acupoints of all. The feeling of this point under the finger is quite like a funnel. Depending on the disease you treat, the depths of needling Chengshan bladder 57 are different. Scenario 1. Suppose a patient has heel pain and cannot stand for long. This problem relates to the kidney, and the needle should be inserted deep, close to the bone. Scenario 2. Suppose a patient suffers a bleeding hemorrhoid. This problem is related to blood, and the needle should be inserted deep, close to the vessel. Scenario 3. Suppose a patient has pain and spasms of the cuff. This problem is related to the tendon, and the needle should be inserted close to the tendon or fascia. The deeper the cramp or tightness happens, the deeper layer of fascia should be selected. Remember, fascia belongs to the concept of tendons. If you find this video useful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!